Hey everyone, Dr. Louie here. I am an OB/GYN physician with USF Health, and I need you to listen up for some very important news. Have you recently been pregnant or given birth in the state of Florida? Are you currently pregnant? If you answered yes to either of those questions, you need to know that your Medicaid coverage now lasts 12 months after pregnancy. Yes, that's right, a whole 12 months. And let me tell you why that's important. Everyone knows that babies need to see the pediatrician multiple times in the first year of their life. It's a given, it's an accepted fact. But the reality is that it is just as important for you to have ongoing healthcare during that time, too. So, for one whole year after pregnancy, you will be eligible for all Medicaid services. And here's what it includes primary care so that you can continue to treat conditions like asthma or high blood pressure. It includes specialty care to treat conditions like diabetes or other specific conditions that you may have that your primary care provider cannot treat. It includes mental health services to address pre existing depression, anxiety, and other mental health conditions, but it also can cover new ones that come up during the pregnancy and in the postpartum period. You will also have access to prescription drug benefits and transportation so that you can get to those medical services. Going to your postpartum visit is important for your physical health and emotional health, but what we're saying is that guess what? It shouldn't be a one time visit. That within that full year after you've given birth, there can be multiple visits for multiple concerns. The goal is just to make sure that you're getting your health care needs addressed. People don't realize that some of the symptoms of postpartum depression may not begin right away. It may happen 2 to 3 months down the road, or you may develop other medical conditions 2 to 3 months down the road after you've given birth. Now, because of this extended coverage, you will have access to the care that you need. And it's important to remember that we're not just talking about when you're sick, you can use these services for routine health care to keep you healthy in that first year, also.
Whether you are pregnant and or breastfeeding, I bet you have lots of questions. Medicaid in Florida may offer you access to an app called Pacify that has your answers. Pacify is an app you download to your smartphone. You can connect to a doula or lactation consultant in less than a minute, live in video, 24 hours a day, 7 days per week. That means you can call any time of day or night. So, if you are pregnant and have questions like, why am I gaining so much weight? Or what ideas should I have to deal with pain when I'm in labor? Or what should I bring to the hospital when I go into labor? Call a Pacify doula. If you have a brand new baby and you have feeding questions like, how do I pump and go back to work? Or can I take this medication while breastfeeding? Call a Pacify lactation consultant. Reach out to your Medicaid case manager today to find out if your plan provides a membership to Pacify at no cost.
But some of you may be thinking, but I'm pregnant with no health insurance. What do I do? If you're uninsured and pregnant, make sure that you talk to a healthcare provider about enrolling in pregnancy Medicaid. You can visit myflorida.com/accessflorida or contact your local health department. They can provide more information. So, in summary, here are the things you need to know. Number one, if you're uninsured and you're pregnant, please make sure you enroll in pregnancy Medicaid. Number two, it's important to continue to get care for yourself, not just during the pregnancy, but within that first year postpartum too. And because of the extended Medicaid benefits, you will have access to that care. And that full year extension covers not just acute illness, but also getting your primary care and ongoing routine care for mental health services. Utilize those benefits like the one you heard through Pacify.